So we'll look at some of the blood vessels, specifically the veins, which are seen on the lateral aspect of the shoulder. We compare both of these specimens, and then what we see here, we might see some of the variations in terms of size of some of those veins. As we see like both of these specimens, let's talk about some of these veins which we see injected in blue. So looking at the dorsal aspect of the antebrachium, as well cranial aspect of the antebrachium and dorsal aspect of the manus, the accessory cephalic vein would be formed by tributaries which are draining blood from the dorsal aspect of the paw. The accessory cephalic vein would continue further up, and it will join the cephalic vein, which is formed by tributaries which are present on the palmar aspect of the manus. So the cephalic vein actually is formed here, and it continues upward. With the cephalic, it comes on the cranial surface of the antebrachium. The accessory cephalic joins that vessel, and both of them continue further as cephalic vein. The cephalic vein would continue further up. At this point, it continues underneath the, and in this particular specimen, as well as in the same one, as well as in this one, it looks much smaller. But in some other specimen, this continuation of the cephalic vein might be much larger than what we see here. It depends on which of these blood vessels are better developed. If the superficial ones are better developed, the cephalic would remain smaller. If the cephalic develops larger one, if it is larger, then the superficial ones like your axillobrachial and omobrachial would be smaller. So we have seen that one in some other specimen. So these variations are depending upon which develops more. The other one may not be that much necessary, so that would develop less. So what we see in these both of these specimens, the superficial ones are larger. So let's track the course of the cephalic vein. So cephalic vein would continue further on the antebrachium, then it will go underneath by the deltoid branch of the superficial cervical, and then it continues further to finally enter into the external jugular vein. We can see that entrance into the external jugular vein in this particular in this particular specimen. Here we can see it is coming deep to the biceps brachiocephalicus and finally going into the external jugular vein. Okay, let's come back to this one here. So we have cephalic vein continued below the brachiocephalicus, then further continuation is called axillobrachial vein, which also gives off a branch a little bit deeper to the between the deltoideus and the lateral head of the triceps and other muscles. It goes deeper here. Then further continuation is omobrachial vein, which finally opens into, or which finally joins the external jugular vein as well. So omobrachial vein going into the external jugular vein, cephalic vein as well, it goes into the external jugular vein. The axillobrachial and one of the tributaries of that, it further goes on the medial side and it joins the subclavian vein on that side. So usually it joins the axillary very close to the point where it becomes subclavian. One of the important thing to notice here, as we look at the lower part of the limb, the superficial veins, they have become larger and they play more role in draining the blood as compared to the deeper veins at that point in the lower part of the limb, or in that particular region in the lower part of the limb. But now let's start looking at the arteries of the forelimb. So the blood supply, which is mainly derived from the axillary artery, the subclavian on each side would continue further as axillary on that particular side. So we have left subclavian continues further as left axillary, the right subclavian would continue further as the right axillary artery. So the axillary artery, as it comes off the or out of the body cavity, then actually it is called axillary. Then it gives off its first branch, which actually is the lateral thoracic, but there are variations in the nature of lateral thoracic, external thoracic artery, but there are variations in there. So sometimes the external thoracic may be derived from the superficial cervical. So that is some sort of inconstant blood vessel. Then we have this branch which is coming into the the branch which is coming into the deep pectoral muscle, as well as passing through that, and also has some branches along the lateral edge of that. So that is your lateral thoracic. So if you see blood vessel coming off the axillary and going into the deep pectoral muscle, that should be your lateral thoracic artery. Then axillary continues further down. Here it gives off two major branches. We might need little. The axillary would split into two major branches or two main branches. That is the subscapular, the one which is going backward and deeper, that is subscapular, and then we have the further continuation is the brachial artery. So axillary would split into subscapular and brachial. So this is the place where we first change the name of the artery. From axillary, it is brachial. Now as we follow the subscapular artery, the subscapular would continue backward. It gives off a major branch towards the latissimus dorsi, that is called thoracodorsal artery, which is still accompanied by the thoracodorsal vein. So that is your thoracodorsal, which is branch of the subscapular. The subscapular also gives off caudal circumflex humeral. We're not going to look at that one at this point, but just know it also gives off the caudal circumflex humeral. From the caudal circumflex humeral you have the collateral radial arteries, but we're not really looking at those at this point. Okay, so what we need to know here is the subscapular, which gives off the thoracodorsal, and then it further continues into the proximal part of the forelimb, rather going to the distal part of the forelimb. Then brachial artery would continue further. It will give off its first branch towards the cranial part of the humerus, which is called cranial circumflex humeral. So the smaller branch which goes on the cranial surface of the humerus, which actually goes underneath the byssus brachii, so that is your cranial circumflex humeral. Then let's see, we'll find that blood vessel. Okay, the one which is right here, that is your cranial circumflex humeral. Then right below that we have another larger blood vessel which supplies the triceps brachii, that is your deep brachial artery. Okay, so at this point this is the deep brachial. Then brachial artery would continue further. Let's put this one aside so we can see the artery clearly. So we have brachial artery continuing further. It gives off the bicipital artery. Then after a little distance it gives off collateral ulnar artery, which has two different branches, but then both of them would be branches of the collateral ulnar. One of them is going to join the ulnar artery as it goes more distally, and this is further backward continuation of the collateral ulnar. Right at the level of collateral ulnar, it also gives off your superficial brachial. Now the same superficial brachial, as it really comes superficially below the skin, it forms a little loop in this region and then splits into two branches, one on the lateral side, one on the medial side, and both of those are lateral and medial cranial superficial antebrachial. These are two major blood vessels which would be also supplying blood to the dorsal aspect of the manus. Okay, so we have lateral and medial branches of the cranial superficial antebrachial. Those are the major blood supply on the dorsal aspect here. So at the beginning it would be called superficial brachial, then it will become cranial superficial antebrachial. Okay, let's continue, or let's follow the brachial artery further down. At this point it gives off another branch which travels a little bit laterally, and it goes around the cubital joint that is your transverse cubital. Okay. So that is collateral ulnar. So we saw the bicipital, we saw the superficial brachial. Okay. So that branch right here, which is running across, going more on the lateral side, that is your transverse cubital artery coming off the brachial. Then brachial continues further into the antebrachium. Here we have transected pronator teres, as well as we have transected flexor carpi radialis. to follow the brachial artery. It gives off branches like ulnar. Then we have the common interosseous. Common interosseous has the branch which is more superficial, remains here, that is the caudal interosseous, as well as cranial interosseous, which goes in between the, or which passes through the interosseous space. Then as at the level of common interosseous, the the brachial artery would now become median artery. It will continue further as a median artery, and soon it gives off the deep antebrachial artery. It looks like there is another division here. Then we have the median artery continuing further through the carpal canal, while we have radial artery, which is branch of the median, which comes more superficially, more on the medial side, which does not pass through the carpal canal. So here we have the radial artery and vein. Here we have the median artery and vein. The two major branches of the common interosseous. According to the book, it shows like three major branches coming off the common interosseous: ulnar artery, cranial interosseous, and the caudal interosseous. But then a lot of variation would be seen in that as well. Sometimes we may have some of the branches, instead of coming off as a trunk, they might come off independently. Okay, so depending upon what region is supplied, we can trace those blood vessels back, and we can decide what blood vessels are those. Usually, as I trace this one back here, which is running along the ulnar nerve, that's going to be your ulnar artery, and the ulnar vein running along with the ulnar nerve. Okay, but then further continuation of the median, as it goes further below the corpus, here it splits into many branches, and that branching is called superficial palmar arch. The caudal interosseous, it goes deeper and also anastomose with some of the branches of the radial artery to form the deep plantar arch, but we're not going to really identify that. Just know that that one is located deep, usually deep to the DDF tendons and interosseous muscles and others. So that is going to be your deep palmar arch. So at this point, this is your superficial palmar arch, where you see the median artery is splitting into few more branches. Okay. The veins of the forelimb, starting from the axillary vein. Further continuation of the axillary within the body cavity would be the subclavian vein. Again, from both subclavian veins, as they come outside the body cavity, those would be called axillary. Now here we see some of the veins which would be more than number of arteries. Usually because of the less pressure, we usually have more number of veins as well. So at this point, what we see is the lateral thoracic artery, as it's only one branch which supplies that area. There would be multiple veins draining that area as well. So this is counterpart of the lateral thoracic. This is also counterpart of the same. So we have multiple branches coming into the axillary. Then as we go further down, the axillary vein is also going to follow the same pattern as the axillary artery. It has two major divisions, the subscapular vein and the brachial vein. So in other words, we can say the brachial vein and subscapular vein would form the axillary vein. Then subscapular is formed by thoracodorsal vein and the main division of the subscapular, which is coming from the deep parts of the proximal forelimb, that is the shoulder region. Then the brachial vein, which we can follow more ventrally, it has corresponding branches like your which is coming into the axillary into the brachial, that is close to the deep brachial artery, and so that is your deep brachial vein. Before that, we will also see the cranial circumflex humeral vein, which is also draining the blood from the same area which is supplied by the cranial circumflex humeral artery. As we follow the brachial vein downward, we can see the collateral ulnar vein, which is located close to the collateral ulnar artery. We might see some of those variations in this specimen. We see like both of them coming in here, as well as like little distance between them, and there is a little branch in the middle as well. So what we see here, those are quite close to each other as compared to this specimen right here. So all of them, they are draining the same area which is supplied by the collateral ulnar artery. So we may still call both of them as collateral ulnar veins coming into the brachial. Now brachial would continue further down. As it goes more distally, we can see this is further continuation of the brachial. There is connection between the cephalic vein and the brachial vein by means of a connecting branch which is called median cubital vein. So that's your median cubital vein which is going in like little loop form. So that is your median cubital vein joining the superficial one and the deeper one. Then it continues further. We also have the common interosseous veins as well as deep antebrachial vein, the ulnar vein draining blood from the same areas where they have supplied by the arteries. So the median vein at this point would follow the median artery, and the radial vein would follow the radial artery. So let's look at that in terms of flow of the blood. The median vein and the radial vein, they come together, like the radial vein drains into the median vein. Median continues further up. It receives blood from the deep antebrachial veins, common interosseous vein, ulnar vein, and then it continues further upward. Then it is called brachial vein, where we have some connection between the superficial, that is cephalic vein, and the brachial vein. That connecting branch is called median cubital vein. As it comes further up, you will also expect to have a small veins like this. That is your bicipital artery, so we should have bicipital vein as well. Okay, so all of these tributaries are coming into the brachial vein. Brachial vein and subscapular vein, they join each other to form the axillary, and axillary would go inside the body cavity. It will be called subclavian. Then subclavian and the external jugular, they join each other to form the brachiocephalic vein on that particular side.